First, I want to give an update on testing. Yesterday, the Commonwealth conducted over 5,000 new tests. That brings us to a total of over 180,000 tests so far. The state reported 1,745 new cases of COVID-19 for a total of nearly 43,000 cases tested positive statewide. The number of new positive cases has remained relatively stable over the past few days, but as we've said before, we're not drawing any conclusions from a few days' worth of data. Yesterday's report contained very sobering numbers on those who've lost their lives to the virus. These numbers are staggering, and we must remember the people behind these numbers. They're our friends and our neighbors, and these people have families and loved ones whose worlds have been shattered by this ruthless virus. It's a good time to remember that all the sacrifice and disruption we're working through is to protect people's parents, grandparents, siblings, children, neighbors, friends, and co-workers. Families are dealing with their loss in uncertain times, unable to gather in person to say goodbye. I know there's a lot of desire on the part of many of us to get back to some kind of a new normal, but these numbers underscore the importance of continuing to do what we've been doing to push back against COVID-19. That means staying at home, pausing businesses in many cases, changing the way we live, covering our face in public, maintaining physical and social distance, and cooperating with community tracing efforts. Our focus needs to be on doing everything we can to prevent and reduce the loss of life due to this virus. I want to give a quick update as well on PPE. As of yesterday, we've delivered almost 5.5 million pieces of personal protective equipment. This includes masks, gloves, gowns, and other items the Command Center has provided to hospitals, nursing homes, and other facilities on the front lines, as well as first responders and emergency management personnel. Yesterday, the state received and validated over 200,000 new testing swabs. The supply will be sent out to support our mobile testing program of nursing homes, rest homes, and assisted living facilities, and testing swabs will also be sent to several healthcare providers in underserved areas across the state to expand their daily testing capacity. The Command Center also recently sent 3,500 swabs and tubes to South Coast Health Systems, who will increase their daily testing capacity by 400 tests a day, and also sent 3,500 swabs to the Cambridge Health Alliance. With respect to hospitalizations and hospital capacity, which I know is an important issue for all of us, the Command Center is communicating daily with the hospitals across the Commonwealth, as well as with medical professionals to monitor the capacity in our system. As of yesterday, there were 3,977 patients hospitalized statewide for COVID-19, and that includes a little over 100 new hospitalizations. In total, 9% of the total number of COVID-19 cases are currently hospitalized, a number that's remained relatively stable over the past few days. Out of 18,000 available hospital beds statewide, ranging from ICU beds to field hospital beds, over half are empty and available for patients. These numbers mean that we continue to see a slight increase in the number of people needing medical attention due to COVID-19, but they also show that our healthcare system planned well and is managing through this crisis. That's good news. As we know, Massachusetts is the home to one of the strongest healthcare systems in the world. From our academic medical centers to our terrific regional and community hospitals across the Commonwealth, these healthcare facilities have been well positioned to help us withstand the surge. We also planned for this. The Command Center worked with the healthcare community to model what this uptick in cases would look like, and then we built a plan and we've been executing on it. We've worked with our academic medical centers, our community hospitals, and our medical teams to craft a plan that is flexible enough to dramatically increase ICU capacity, dramatically increase bed capacity, and at the same time create step-down capacity so that patients who didn't need to be at an acute level anymore could be moved to a lower level setting. All in all, this process has given us the structure and the flexibility and the capacity that we need here in Massachusetts to work our way through the surge. It also means our hospitals are well positioned to deal with and take care of the other elements of care that are so fundamental to the work that they do every day. And to some extent, that's part of what we want to talk about today. Many hospitals have reported a reduction in patients seeking care for other serious medical conditions, like heart problems, dialysis treatments, and cancer treatments. We know these medical conditions didn't stop when COVID-19 picked up. And our hospitals and our healthcare providers have made accommodations for COVID-19 to ensure that they can also care for the other healthcare problems that they come across every day and do it safely. The purpose of all that surge planning and response was to ensure that our healthcare system would not be overrun and could continue to respond to other emergency needs. People should still call their doctor to talk about their health needs and go to the hospital if they have an emergency. People have worked hard to set up telehealth services, which they've been using to help people talk to clinicians distantly using either video chats or phone conversations to determine whether or not, in fact, they need to be physically seen by somebody. We've also added the Buoy Health system, which has tracked over 85,000 connections so far with people who've used it for self-diagnostic purposes, and if people, based on their data and their submissions, needed to speak directly to a clinician, that's been made possible. And of course, call 911 in an emergency to get to a hospital if you need immediate help. We don't want people getting sicker or exacerbating an illness or an injury, and it's important that people are cared for when they're sick, whether that's for COVID-19 or for something else. Just a few days ago, as part of the regular calls we have every day with hospital CEOs, we discussed this concern over patients delaying life-saving treatment out of fear. And I asked the CEOs to do what they could to get the word out. Many of our facilities have worked together like never before since the beginning of this pandemic, sharing innovative solutions and essential equipment. And the Commonwealth and its people have benefited tremendously from this collaborative approach. And having been involved in the healthcare world for much of my professional career, I can tell you that these hospitals and these organizations are typically, well, pretty competitive with one another. And it's been remarkable to see them work together to make sure that they, you, and we have the capacity and the ability to serve both those who are dealing with COVID-19 and those who are dealing with the other issues in medicine that are much more traditional to what they see every day. And it's terrific that the 6 Boston teaching hospitals participated in a series of TV public service announcements asking residents not to delay care. I want to thank Tufts Medical Center for taking the lead on the project, and local video production company Last Minute Productions for donating their time. The 60 and 30-minute PSAs will be played on all Boston TV stations starting today. I want you folks to take a look at the video, and then after it plays, I want to ask Dr. Michael Apkon, who's the CEO of Tufts Medical Center, to come to the podium and share a few thoughts.
We want to talk to you about medical emergencies.
The kind that result in a visit to the ED before the coronavirus hit.
The kind that would start with chest pain and swelling.
Or with difficulty speaking and drooping of the face.
Or an accident, like a fall, or the slip of a kitchen knife.
These are still the kind of emergencies that require a trip to your local emergency department.
Despite this pandemic,
We assure you, hospitals are doing everything possible to keep emergency departments clean and safe.
And we are here to provide care to you and your family, but you must not delay.
because when it comes to your health, time can be the difference.
Between life and death.
If you experience a medical emergency, call 911 or go to your local emergency department.
Thank you, Governor Baker. We're honored to be here with you and Secretary Sutters today, and we very much appreciate the partnership that the hospitals have had with both the state and the local government. It is true that we are quite busy caring for patients with COVID-19, but we have a growing concern about what we're not seeing. We're not seeing the same number of patients coming to our emergency departments with strokes, with heart attacks, with traumas. In fact, we're seeing about half of the activity that we would normally see during the month of April. We've seen a 60% reduction in the number of patients coming for care of symptoms related to stroke, as one example. This is in part explained by the fact that people aren't on the roads. They're not exerting themselves the way they normally do. But we also know that part of it is because people are afraid to come to the hospital. And our concern is that that fear is leading to adverse outcomes. We've seen children coming to the hospital after having several days of abdominal pain and coming with a ruptured appendix. We've seen patients with symptoms of stroke that are staying at home long beyond the point at which medications that would markedly improve their outcome could safely be delivered. We've seen patients with kidney disease that are staying at home, coming to the hospital too sick to be cared for and survive. We understand the fear that people have, but what we want people to know is that we are keeping you safe at the hospital. We're decontaminating our surfaces, we're practicing social distancing, we're using masks, and we're doing everything that we can to keep you safe. If you are ill, please call your physician to seek care. If you're the victim of violence or domestic abuse, if you're having chest pain, if you're having shortness of breath, or if you're having weakness that might be a sign of a stroke, a heart attack, or a severe respiratory illness, call 911 or visit your local emergency department. What we want you to know is that we're here to help you, we can keep you safe, and please don't delay care that might be vitally important at this time. Thank you. Sure, I'd like to introduce Greg Meyer, who is the Chief Clinical Officer for Partners Healthcare.
Good afternoon. Thank you, Governor Baker. Thank you, Lieutenant Governor Polito. Thank you, Secretary Sutters. And a very special thank you to my colleagues who join me here this afternoon. COVID-19 is a horrible disease that is caused by a vicious virus that has extracted a horrible toll, despite the incredible supportive care that our hospitals can offer. That is not always in our control. But we need to avoid a second toll of the pandemic, one for which we do have treatments that work, one that we can control. As we focus our collective energies and resources on combating COVID-19, there's been a less noticed but equally troubling development inside Massachusetts hospitals: a growing number of empty beds in our emergency departments. We are seeing evidence that many people are avoiding seeking medical attention for a variety of urgent issues because they fear possible exposure to COVID-19, or they may not be aware that world-class care here in the Commonwealth is still available to them. At Newton Wellesley Hospital, we treated 5,400 patients in our emergency room in January. In the last 31 days, that number has dropped to just 2,800. And nearly half of those were COVID-19 cases. That's a 48% drop in emergency department volume in just a few months. Some of this is due to our social distancing. We're seeing fewer motor vehicle accidents because fewer cars are on the road. But we also know that there are many life-threatening conditions which do not respond to social distancing. Last year, our hospital treated an average of 20 stroke cases each month. So far this month, we've seen only 7. Sadly, there's no medical reason that I can come up with that states that strokes should be dramatically impacted by social distancing. We don't believe that this means fewer people need urgent care or are having strokes, but we think that it's because people are avoiding critical medical care necessary to treat and recover from those illnesses that we are ready and open to deal with. Since the current pandemic began, we are seeing advanced vascular disease such as leg ulcers and vascular insufficiency that is leading to amputations. One of my surgeons said to me last week that he has done more amputations in the last few weeks than he can ever remember. The story of each of those patients was the same. They knew they had a significant problem, but they wanted to try to take care of it at home because they really wanted to avoid coming into the hospital. Because of that, we were not able to provide them with limb-sparing treatment. Providers are also seeing more cases of advanced cardiac and GI disease. In the Mass General Brigham system, we've seen a 37% reduction in the number of patients coming in with heart attacks, and we've seen a 14% reduction in appendicitis. Sadly, as with COVID, these reductions, which could signal delays in getting care, are impacting our most vulnerable populations in a disproportionate way. This delay or avoidance of emergency care is extremely concerning, as many seemingly minor symptoms can develop into much more serious illness when not treated. For those of you who might be wary of visiting a hospital during these anxious times, let me assure you, Massachusetts hospitals are open for business. We have the beds, we have the physicians, we have the nurses, we have the specialists, we have the resources to treat you. Our healthcare system is effectively caring for COVID-19 patients while also maintaining the capacity to treat any other patient who requires emergency medical care. Through a partnership with the governor, the mayor, Boston Healthcare for the Homeless, and area hospitals and health systems, Boston Hope, and there are other facilities like it across the Commonwealth, are meant to ensure that our healthcare system has an ability to treat patients with acute care medical needs in our acute care hospitals. Please know that Newton Wellesley Hospital and all Massachusetts hospitals are taking comprehensive precautions and doing everything possible to keep our emergency departments and inpatient facilities safe. We have developed policies and procedures to ensure that for those who need it, the hospital is a safe place despite the pandemic. We have also vastly increased our ability to treat patients remotely, removing the need to see patients unless there is an immediate need to do so. Remote care through telehealth provides a convenient and rapid means to have what seems to be minor symptoms assessed by professionals who can determine whether a trip to the emergency room or a face-to-face evaluation is necessary. We're also reminding the public, if you experience chest pain and sweating, slurred speech and facial drooping, severe abdominal pain, an asthma attack, or suffer an accident like a fall or a deep cut, or any other symptom that causes you concern, we urge you to seek medical attention as soon as possible. Those are situations where remote care is not appropriate. Call 911 or go to your local emergency department. Please continue your social distancing, but do not let fear of COVID-19 to keep you from the emergent and urgent care you need. Our doctors and nurses will be there for you to provide the world-class care that the Commonwealth is known for. Thank you very much. Now we'll hear from my colleague from Bay State.
Thank you all for the opportunity to be here with you. I am Nancy Shendel-Follick, president of Bay State Medical Center, and here to share what's happening in Western Massachusetts. As the president of Bay State Medical Center, which is the tertiary academic medical center for the western part of the state, and the only one there, and I want to assure all of the citizens of the Commonwealth in the western part of the state that our priority is patient safety. It always has been, and it always will be. Safety of our patients comes first. We have made necessary changes to ensure that safety and want all to know that they should come to seek the needed care. Serious consequences of not getting care have been discussed by my colleagues, and I want to share a little bit more specifics about what we have seen. We have seen patients an 80% decline with stroke symptoms, meaning speech impairment, visual changes, wait at home, and not seek care. That was 1 month ago, a total of an 80% decline. Those patients are starting to arrive at Bay State Medical Center. They are seriously ill, and many of them have lifelong debilitating consequences to waiting. In our cardiac care areas, we have not seen a great decrease in numbers. However, we've had patients that have described having severe symptoms for 3 days, patients that walk 2 miles a day that are unable to walk up a flight of steps, that are afraid to come to the hospital. Decrease in blood flow harms organs. We want you to know that you can mitigate these consequences. And like is described by my colleague, we have seen more amputations as well due to the fact patients cannot have limb-sparing procedures. They have waited at home. When we look at surgery across the Commonwealth, we deliberately postponed needed elective surgery. It is now 6 weeks later, and some patients are saying they see a change in their condition, and they think they stay on perpetual hold until we call them. Some patients have described that and have been advised to come to our hospital, and they fear doing so, that they might get COVID even more than treating their serious illness. So if your provider recommends that you come to the hospital, please heed that warning. We are safe and we are here for you. We know that things that seem like a simple hernia or a gallbladder with pancreatitis might be able to wait, yet 4 or 5 weeks later, there can be serious complications from surgery. As the only full-service children's hospital at Bay State Medical Center and the only full-service in Western Massachusetts, our pediatric emergency department normally sees 120 children per day. Now, with the arrival of COVID, we are seeing 25 to 30 children per day. And what we know is that chronic care and chronic diseases do not wait for this pandemic to subside. We have seen children that have diabetes, who have fever and fatigue that last for days, whose families are absolutely frightened to seek necessary care. And we unfortunately have seen some with consequences that cannot be reversed. We know, like was described, others where belly pain leads into appendicitis and an appendix that is now ruptured that could have been more easily treated had a patient arrived earlier. We are also seeing 20% fewer patients in our behavioral health emergency department. And we know that patients suffer from anxiety and depression. And we want them to know to call their primary care provider or their psychiatrist, and if they are recommended to come to the emergency department, to please do so. We want to care for you. We are here for you. The Bay State Health Hospitals have over 1,000 beds. Today, we are caring for approximately 150 COVID patients and 400 non-COVID patients, so we have plenty of capacity. We have space, we have changed our processes to ensure your safety and encourage you to seek necessary care.